Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about exotropia and what it looks like if we're correcting that in a patient. I actually have two awesome adult success stories to share with you tonight, and I have some tools sitting around on my desk that I'm going to talk to you about just a little bit. But before we get into that, let me tell you how you can connect with me. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you have two choices. You can either fill out a questionnaire or you can schedule a consultation and talk with me about how we might be able to help you. Now, let's talk about exotropia. It's a condition in which the eye is turned outward or may alternate, might be constantly one eye, it might be intermittent, or sometimes the eye is lined up and other times it turns out, or it may be alternating where it flips between the two eyes. Now, in exotropia, it's particularly frustrating for the person to be able to try and control and align their eyes. They may see double at distance, or they may not. If they're suppressing or ignoring the eye that's turned out, they won't see double at all, but will affect things like their depth perception, may affect their ability to do things in a classroom, park a car, manage and understand spaces and things around them. Can affect things like reading, staying awake with reading, being able to focus on reading and not seeing print kind of wiggle and move around on the page or seeing double, and certainly can affect things like reading comprehension, maybe even handwriting. So exotropia can have an effect on many areas, including it can have an effect on a person's feelings about themselves or their confidence level, depending on how they feel they look because of the eyes not lining up. So I want to share with you two success stories of patients that we have that we're working with our clinic right now. And these individuals have given permission, although I won't share their names or divulge any specific information about them, but they have given us permission to share their story. So in this top picture, you can see that the two eyes are not aligned, that one eye is really looking off to the side. And in this lower picture, you can tell that the eyes are much better in sync with one another. This eye is still slightly off just a little bit, but not nearly as significant as what you see in this upper picture. Now let me share with you another one. This is another awesome picture of a patient that we're working with right now. And you can see up here, this eye is turned out, and this eye is turned out. And you can see down here at the bottom, after we've been working with him for approximately 5 months or so, that he's looking pretty aligned and straight with both eyes. And both of those patients, again, gave us permission to be able to utilize their pictures, so we're really grateful that they shared their story. A lot of times it's super hard for adults to want to share their story online, maybe because they don't want their identity to be known, or they're concerned about what they would look like. And so we love it when our adults will share these sorts of stories and photos with us, because obviously it helps you. If you're watching this video and maybe your child or maybe even you yourself has an exotropia and you really didn't think there was any hope for doing anything to correct it at all, well, I'm here to tell you differently. So here's what we do. We utilize two different phases of our program. The first phase is called Syntonics, and that is where we're using specific goggles to tell the brain exactly how to align the muscles of the eyes and to trigger the muscles to pull the eyes straight. So there are specific filters that electrically kind of trip the muscles of the eye that allow that eye to just kind of swing out and tell it to line back up and pull back in. And then we come alongside with activities in phase 2, and with you working with a therapist to teach and guide your brain and eyes how to function better together as a unit. Now, some of the things that we utilize, this is called a Brock string. And you may have seen people talk about this, or me talk about this on the internet. And so a Brock string is used. What you do is you hold the string up to your eyes and nose kind of area. You look at the bead, and there are certain activities that you work on for teaching your brain how to use the two eyes together. We also have another tool here that we use, which is called an Aperture Rule. And so this thing has a little card system attached to the end of it. What you would do is that you line up your eyes at the end of this little aperture or ruler or stick, and you see if I can get those cards straight. And what you do is you try to sync up so that each eye is able to look at those images. There's also a little window that goes on it right here, but kind of was a little impractical to show that on the video. And so the window will either have, let's see if I have it to show you. I do have it. Look, I didn't know if I did. All right, so this is the window. If we're trying to get you to learn how to converge and cross your eyes, we actually use this window right here. If we're trying to get you to take the eyes apart and relax them, we would use this. So in the instance of someone having a convergence problem or an exotropia like we've been talking about today, then we would have this. Let's just put it on here real fast. We would have this window on the Aperture Rule. You would look with your eyes looking through that one window, crossing together in order to try and put these two little sailboat images together. Now, these things have some depth perception, so we can teach you how to have depth, which is important for things like, you know, making sure that you are in the correct amount of space around you for like parking a car, maybe riding a bike, going up and down steps, playing a sport. There are lots of things that depth perception is obviously important for. So this is one of those tools that can help train someone who has exotropia, in addition to a Brock string, and in addition to a lot of other pieces of equipment, including our Syntonics goggles that we use to train people how to learn how to align their eyes and to go from something like this to like this. Again, if this is you or if it's someone that you know and you're thinking, oh my gosh, there's actually hope for me or there's hope for my kid, then contact us if you're local. Call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you can do one of two things. You can either fill out a questionnaire or you can click on the schedule a consultation and schedule a consultation time directly with me. We'll talk to you about these different tools that we use and how we will train your brain to learn how to align and use your two eyes together without the need of something invasive like surgery. If you like the video, hit the like button. If you feel like this is really important and you know someone, then please pass it on. And obviously, if you've not done so already, please subscribe to our channel so that you get notification of all of our videos. Thank you.